Smith. My name is Kate, and I'm going to be your student nurse today. Let me just wash my hands first. Can you confirm your full name and your date of birth for me?
My name is Jane Smith, and my birthday is January 1st, 1997.
Excellent. That matches my records too. So what brings you in today?
I've been having some stomach issues.
Okay. Have you noticed any appetite changes recently?
Yeah, a little bit. I haven't been eating as much.
Okay. And have you had any abdominal pain at all?
Yeah, like cramps.
Oh, cramps. Can you show me where approximately?
Like here.
Right there?
Yeah.
Oh, okay. And is it, so it's a crampy pain you said?
Yes.
And on a scale of 0 to 10, what would you rate your pain?
Like 6.5.
6.5? Okay. Have you noticed any change in your bowel habits? Like any constipation or diarrhea?
Yeah, like diarrhea about like twice a day.
Twice a day? Okay. And what color is it?
Brown.
It's brown? Okay. And is it a really watery diarrhea, or is it a bit thicker?
Thick and kind of loose.
Thick is just, you could be a loose stool, you'd say?
Yeah.
Okay. Do you have any history of food allergies or intolerances at all, or have you noticed any changes when you're eating certain foods that your stomach gets more upset?
Maybe like bread.
Bread?
Yeah.
You've noticed that you tend to get aggravated symptoms when you eat that?
Yeah.
Okay, I'll note that down. And do you have any history of any abdominal issues before? Have you had any hernias? Have you had any history of colitis? Do you have any family history or past surgeries at all?
No, I don't think so.
No, not at all? Okay, so the doctors asked that I do an abdominal exam. Is that okay with you?
Yeah.
So in this exam, I'm also going to be looking at your gastrointestinal tract, so that also includes your mouth. So
Okay.
I'm just going to first, can you open your mouth for me? Good. I'm just seeing if there's any ulcers and if the color's okay. Can you stick out your tongue? Good. The color looks good and there's no coating. Excellent. And now, if it's okay with you, can we put the exam table back? Like that. And if it's okay, I'm just going to inspect your abdomen. So if you want to just pull up your shirt just a little bit, and you put your pants down a little. Perfect. So I'm just looking at your abdomen to see if it's symmetrical, to see if there's any lumps at all, and everything looks good. Next, I'm going to auscultate your abdomen, which is just a fancy word where I'm going to use my stethoscope, and I'm just going to listen to your bowel sounds, just to make sure that they're normal. Is that okay?
Yeah, that sounds good. Yeah.
Sorry, it's a bit cold. Just right, that sounds normal to me. Sorry, I know it's so cold.
Yeah.
Good. Good, so your bowel sounds normal, which is good. Now I'm just going to palpate your abdomen if that's okay. First I'll do light palpation and then I'll do a bit deeper, so I'm going to start here. You tell me if anything hurts too much and we'll stop.
Okay.
Just making sure there's no lumps. And we're going to do deeper palpation. Sorry.
It's okay. Yeah, that actually does hurt a little bit, like that one.
That one?
Yeah, like
Okay.
it just feels like kind of like a cramp.
Crampy? Okay.
Yeah.
All right. Now I'm gonna do something where I take my hand and it's called percussion. So I'm just gonna tap my finger against it, and it just lets me, I hear different sounds, and so I can tell where certain organs are, or if your tummy has things in it, then it'll let me know. So I'm going to start here. It's a hollow sound, so that's good. And then what I'm gonna do is I'm gonna move my way up and I'm gonna measure your liver span, okay?
Okay.
So hollow sound, and your liver starts once I hear a dull sound.
Is that my liver?
So that's the first dull sound, so that's the first point. I'm gonna remember that spot. Alright, and then get my ruler here. Sorry. 8 centimeters, so that's normal. So I'm just gonna listen to your other quadrants. Good. Good. All right. So I'm gonna talk to the doctor, and I'm gonna let him know about your diarrhea, and I'm also gonna let him know about your abdominal pain, as well as that you're finding that bread is aggravating your symptoms, and they'll come in and they'll talk to you and they'll come up with a plan as to how I think that we should proceed. Does that sound good to you? Do you have any questions for me at all?
No.
Perfect.
Okay.
Thank you so much, Miss Smith.